Breast augmentation has become one of the most common cosmetic procedures for women in the world. But what most women don't know is that implants block mammograms from seeing all the tissue in your breast, which could delay early detection of breast cancer. News 4 troubleshooter Delane Matthew is here with exactly what you need to know to protect your body and your breasts for your health tonight.
With the popularity of breast augmentations, you would think this information would be common knowledge on every single pamphlet and website that talks about breast health. But a lot of women do not know that mammograms can't see through implants. I didn't know until I happened to ask during a mammogram. So I sat down with the head of the radiology department at the UT Health Science Center. She told me it doesn't mean you shouldn't have implants. It just means you need to be extra careful.
This is what a woman's breast without an implant looks like in a mammogram. A large portion of the breast tissue is easy to see. This is what a breast with an implant looks like. And the implant is about all you see. Big difference.
The silicone or the saline itself blocks breast tissue so we can't see through it.
Dr. Pam Otto with UT Medicine says implants, especially ones placed above the chest muscle, can block 50% of the breast tissue and prevent radiologists from seeing those teeny tiny indicators of cancer.
It's very, very dense, and on mammography that means it's very white. And what we're looking for in breast cancers is a very white thing. So I have a very white thing that can block out another white thing.
She says implants placed under the chest muscle are better when it comes to seeing more of the tissue. But even then, they still cannot see 100%.
I'm missing breast tissue on this one because I'm not getting any of this. I can't push that whole implant out of the way.
So what can be done?
And this is the smush from side to side.
During a mammogram, extra pictures are taken of the breast to get as many angles as possible around the implants. And they'll even move the implants around to expose as much tissue as they can.
You push the implant out of the way and try to pull all the breast tissue forward, and hopefully you can get most of the breast tissue then in your image without that artifact from the implant.
Also, and this is key, regular self-breast exams. They are vital for everyone, but especially if you have implants, since they can actually make it easier to fill lumps around the breast. That's how Dr. Otto says one of her patients found cancer.
So what I did was sent her for an MRI to further work it up, and her cancer was easily detected with MRI.
Was it early or late stage?
It was very early stage.
Really good information, but here's some more. Another layer of protection, especially if you're high risk for breast cancer and have dense breasts. Have an MRI or ultrasound. Those machines are able to see through implants. And if you're thinking about getting implants, talk with your doctor and your plastic surgeon to make sure you're making the right decision for you. I'm News 4 troubleshooter Delane Matthew.